Florence Nightingale was born on May 12, 1820, to a wealthy, upper-class, politically connected, and influential family. Florence, expected to behave according to the cultural ethos of the Victorian era, rebelled against the social mores constraining women and became educated by her father. Florence sought a meaningful life. Enraged at her culture's dismissal of women as vehicles for reproduction and pleasure, Florence achieved great social reform, designed hospitals, created medical recording systems, developed statistical approaches for public health management, and designed a standardized nursing curriculum used internationally. Her data-driven, evidence-based approach to matters of morbidity and mortality earned her membership in the Royal Statistical Society in 1858, the first female member elected to that society. Nightingale defied categories of gender and provided public leadership during an era of great social change in England. In October 1854, a correspondent covering the Crimean War for London's The Times shocked Victorian England with his scathing criticism of the abysmal medical care given to British soldiers at the military hospital in Scutari. He awoke the conscience of the British public, fueling national humiliation. Florence Nightingale promptly responded, galvanizing 38 volunteer nurses to provide care at Scutari. During her 2 years at the military hospital, she crafted solutions to the debacle that was Scutari, drastically lowering the death rate. She quickly became a national heroine, termed the Lady with the Lamp. Nightingale was a pioneer in the visual representation of data. She designed a form of pie chart to illustrate seasonal sources of patient mortality. Her classic rose diagram was a powerful tool to convince Parliament that change was needed in both the construction of military hospitals and the sanitary management of patients. She advocated for increased rigor in treating patients, with emphasis on diet, beds and bedding, unit triage, bandages, and waste disposal. Due to her overwhelming statistical evidence, sweeping changes were instituted in British military hospitals. Nightingale catalyzed the British War Office to change practices through her data. Florence said that she was always one to, quote, bite on a fact, unquote, and that she found statistics, quote, more enlivening than a novel, unquote. Her statistical prowess is noted in this table illustrating number of deaths in different English hospitals. Illustrations such as this led to public outrage with resultant massive redesign and change in hospitals. Saying that she would, quote, eat straight through England, unquote, in order to achieve her goal of reforming the British military system, Florence Nightingale used data as her tool. She published a table comparing the mortality of British soldiers at home in peacetime versus mortality of non-military Englishmen. This dramatic table hit the public press, her court of public opinion. The War Office was, needless to say, overwhelmed. Armed with data as tool and as weapon, Nightingale stimulated the restructuring of the Army Medical Department framed on sanitary principles. Nightingale was a pro at cultivating influential male friends in positions of political power. At Scutari, she funneled her energy and focus on the hospital system. She devised a patient triage system, established a laundry system, ordered food to be allocated according to patients' needs, and demanded that water pipes be flushed, that sewer drains be declogged, and that airflow and ventilation be improved. She had patients grouped in units according to illness and nursing care needs. Beyond Great Britain and India, the Northern Army during the American Civil War sought Nightingale's technocratic advice on hospital design, patient triage, and basic nursing care. Florence Nightingale published her Notes on Nursing, What It Is and What It Is Not, in 1860. Seeing nurses as essential tools for sanitary management of patients, she viewed nurses as necessary public health equipment. Sanitarians, nurses, required knowledge of sound sanitary practices that extended from the individual to the general public. Her 1863 companion book, Notes on Hospitals, instructed hospital architects to conform to her detailed outline of construction principles. Her principles were elementary: fresh air, light, ample space, and subdivision of sick into separate buildings or pavilions. Both books operated during the umbrella theme of reform: social reform, public health reform, sanitary reform, and management reform. These two books influenced many generations to come. In July 1860, the Nightingale School of Nursing opened its doors at St. Thomas Hospital in London. She handpicked her students, the Nightingale nurses, who were trained in a one-year program. Graduates, all unmarried and thus untethered to fulfilling needs of husbands and children, became missionaries. They were detailed to hospitals in England, Europe, and elsewhere in order to advance efficient sanitary principles of care. Nightingale's school, founded on her goal to improve morbidity and mortality through sanitary management, was a purposeful, self-conscious initiative to diffuse sanitary health reform both nationally and internationally. In 1855, Queen Victoria sent Nightingale a brooch designed by Prince Albert as a sign of her appreciation. Depicting a St. George cross, the letters VR, and the royal cipher, the brooch was inscribed with the following on the back: To Miss Florence Nightingale, as a mark of esteem and gratitude for her devotion toward the Queen's brave soldiers, from Victoria R., 1855. The brooch became known as the Nightingale Jewel. In 1907, 3 years before her death at the age of 90, Florence Nightingale was awarded the Order of Merit from King Edward VII, son of Queen Victoria. Nightingale was the first woman to receive this accolade. At age 35, Nightingale's image as leader, idolized by the British people, was solidified through her work in the Crimea. At 90, she was a national icon. During the Age of Empire, Nightingale welcomed challenges on a grand scale. She framed all actions within the empirical mantra of sanitary and public health reform. Focused and disciplined, she employed her skills in statistics to determine root causes of problems. Subjective stories, emotional responses, were rejected as useless. She moved as far away from feminine attributes and behaviors as possible. A highly acclaimed social reform activist within the constraints existent in Victorian culture, Nightingale forced remarkable change by exerting influence among those in power and through her prolific writing. Ultimately, Florence Nightingale was both the Lady with the Lamp and the Dark Angel of England. With keen anticipatory vision for opportunity, superior interpretive communication ability, passion for inquiry through empirical methods, political acumen, alignment towards common ground, unabashed willingness to accept grand challenges, and remorselessly decisive action, Florence Nightingale led. In June 1867, Florence Nightingale wrote to a friend, quote, "The ultimate destination of all nursing is the nursing of the sick in their homes. I look to the abolition of all hospitals and workhouse infirmaries, but it is no use to talk about the year 2000.